looks like we got a chat from Kelly. So Kelly's mentioned added in the chat, I'm checking with Trillium's Appeals and Grievances team to see what form they use for a member to authorize a provider to act on their behalf for an appeal. Great. Thank you, Kelly.
Sounds great.
All right. So we'll move on then. On to our unwinding update and equity data from Sean. Sean, are you here today? I don't hear you, Sean. If you're here and speaking, your mic might be on mute. Let me check. I don't think I've seen Sean on here. Okay. Follow up with Sean to see if he could probably present with us later. Something must have came up. All right. So the next thing we have on our agenda is the EPSDT team providing us an overview and update as far as the program. All right, and okay. So is Jessica and Paige here today?
I am here. We were on the agenda for much later, so I'm not sure if Paige is here. Let me see if she's available.
I'm here.
Oh, you are here. Oh,
Yes.
great.
Thank you so much. And do you have slides that you'd like to share? I'm not sure if we have you as presenters.
That would be great. And let's see here. Where did my, there it went. There we go. I wasn't quite ready yet, so sorry.
No worries, no worries. Thank you. Thank you for your flexibility, though, too, Jessica and Paige.
Sure. There we go.
Great, we do see slides.
Yay! Okay. That is good news. So thank you for having us here. My name is Jessica Ickes, and I am the Medicaid EPSDT lead. I use she, her pronouns. I am a member of the Cherokee Nation. And I will let Paige introduce herself.
Hello, everyone. Paige Snow, she, her pronouns. I am the Medicaid Child and Youth Research Analyst for the EPSDT team. Happy to be here and to learn more about the group.
All right. So one thing we have learned to ask is, and you can just do it by a quick raise of hands, but how many of you had heard of EPSDT? How many of you never heard of it? This is a strange acronym, and we understand that. Except I can't see people's hands, so Paige, you have to tell me.
We are seeing lots of thumbs up.
All right, that is a good sign.
Good amount of thumbs up.
So just quickly, we will go over what learn about OHP services are covered and for whom under EPSDT, understand what has changed and what hasn't, and know how to advocate for members who are denied services, and know where to access additional information and submit questions. So what has changed? So EPSDT is the Early and Periodic Screening, Diagnostic, and Treatment program. It is federally required benefit and provides complete coverage for healthcare services for children and youth under the age of 21. Those under 26 with young adults with special healthcare needs, which is WISHN benefits, who are enrolled in Medicaid and the Oregon Health Plan. EPSDT covers all medically necessary and medically appropriate services based on the member's individual needs. And in Oregon, EPSDT is the Child and Youth Benefit Program within the Oregon Health Plan. You do not have to enroll in a separate program. Our webpage is at the bottom here, oregon.gov/EPSDT. Please bookmark that, put that into your browser. It is a living web page. We do update it on a regular basis. Let's see here. Are you guys seeing the slides, or are you seeing my the notes as well?
We're seeing everything, Jessica.
That's kind of what I thought.
Yeah.
Sorry, 1 second here. Oops. How did I do that? I want this one. I apologize. I'm going to stop sharing and then reshare because I'm not sure what I did. Now my computer is doing all sorts of fun things.
You can also send me the slides, Jessica, and I can present for you.
That would be way too easy.
I can share the slides.
Can you do it, Paige?
Yeah.
Yeah. Thank you. I'm not sure what I did there. Apologize for the technical difficulties.
No worries.
Is this where we were, Jessica?
Yes. Thank you. This is why we have teams. Who qualifies for EPSDT services? So the Oregon Health Plan members, birth through 20 years. So on your 21st birthday, you will become a part of the adult benefit package. OHP members under 26 with WISHN benefits. That is the group that will extend until the age of 26. These policies apply for both open card and fee-for-service members, as well as CCO enrolled members. EPSDT covers more than 1/3 of OHP members. So as of January 2025, we have about 37.7% of all OHP members who qualify for EPSDT. And as of January 2025, 651 OHP members with EPSDT benefits due to the WISHN program, which is pretty exciting. Next slide. Most EPSDT services have been provided in Oregon for many years. However, until 2023, some treatments could still be denied for members 20 years and younger. This was due to an agreement Oregon had with the federal government based on the prioritized list of health services. So as of January 1, 2023, all medically necessary and appropriate services are covered for OHP members 20 years old and younger. Also, as of January 1, 2025, members with WISHN benefits also receive EPSDT services. And I'm not going to go through, since so many people actually have heard of EPSDT, I am not going to go through all of the covered services, but please do note that in Oregon, we use the Bright Futures periodicity schedule. We have used that for a long time. That is not changing, and that we will continue with that going forward. Next slide, please. Again, same thing, medically appropriate and medically necessary services. I'm not going to read through all of them. Next slide. However, this does not mean all services are covered in all cases. So CCOs and OHA may require prior authorization for some services. However, it is a federal requirement that prior authorization cannot be required for screening services. Services must have an appropriate diagnosis and billing code, must be eligible for Medicaid coverage. CCOs and OHA may require use of a preferred provider network, and Medicaid must be a good steward of resources and may choose to cover the least costly effective option. Next slide, please. So OHA and CCOs must both comply with the EPSDT policy change that's been in effect since January 1, 2023. Ensure that services to OHP members 20 years old and younger and those under 26 with WISHN benefits are not denied without an individual review for medical necessity and medical appropriateness. Both CCO and OpenCard must abide by definitions of EPSDT medical necessity, EPSDT medical appropriateness, and EPSDT dental appropriateness that are in our OAR 410-151-0001 and follow the Bright Futures periodicity schedule. What we can differ in is the prior authorization procedures and billing procedures. Next slide. So what is medical necessity and medical appropriateness? So EPSDT medical necessity, medically appropriate, and dentally appropriate are defined in our OARs, but in general, medical necessity means a treatment that is required to prevent, diagnose, or treat a condition or to support growth, development, and participation in school or work. Medically appropriate means that the treatment is safe and effective. The definitions of medical necessity is a requirement by the federal government. And so all 50 states have a definition of medical necessity. Oregon separates out medically appropriate. We are a little different in that. Most other states combine medical appropriateness and medical necessity in one. And so that's why we have to meet both in Oregon. It's an and, not an or. Next slide. CCOs and OHA are required to provide comprehensive EPSDT medically appropriate and medically necessary services needed to treat and ameliorate health condition for members 20 years old and younger and those under 26 with WISHN. The term ameliorate is the big difference between the EPSDT program and the adult program. We do not have to cure something, but we have to lessen it and we have to make it better if we can. This includes services which, based on the child's individual circumstances, improve the child's ability to grow, develop, or participate in school. Providers may need to send information that demonstrates medical necessity and appropriateness to OHA or the CCO to get a service covered. Next slide. So we have some examples for medically necessary but not medically appropriate. A drug that is used to treat a condition but is not safe for the particular individual because it would have an adverse interaction with another drug they are taking. An expansive medication is prescribed with a generic that is available. So something that is medically appropriate but not medically necessary is acne medication. We get this question a lot for a youth with acne, but the acne is not impeding their functioning or participation in school or other activities. A child with a broken front tooth who could have a cap but is not in pain or experience any impaired function. Next slide. Intensive in-home behavioral health treatment. Prior to EPSDT policy change, 2 mental health diagnoses above the line on the prioritized list were required. After EPSDT, they may meet medical necessity and medical appropriateness if they have anxiety and a Z code. So it just depends on the individual. Next slide. Residential services. Prior to EPSDT, ADHD diagnosis was only approved for outpatient. However, after EPSDT, ADHD may be approved for residential if determined to be medically necessary and medically appropriate. So what if a service is denied, and what rights do the members have? So a service can be denied when the service is not medically necessary and medically appropriate for that individual. Any denial of OHP coverage must be in writing. Providers should not refuse to provide care or make necessary referrals. Providers should always make the case to the CCO or OHA for coverage of a medically necessary or medically appropriate service for a member with EPSDT benefits. We are working hard on provider education. Any assistance is appreciated. Please do send out our webpage, and we will put our email address in the chat as well. But we know there are some providers who may not have heard about changes in coverage and make assumptions about coverage. Next slide. OHP members must be provided a written denial notice letter when denying a service. This is a requirement for EPSDT, so anyone under the age of 21 or who is receiving services for WISHN. This may come from the CCO or from OHA. Notices must contain a statement of the intended action and effective date, the specific reasons and legal support for the action, an explanation of the individual's appeal and or hearing rights, and the member's rights to representation. These are federal requirements what must be in the notices. Next slide. So if a member or guardian or provider disagrees with the denial or a decision, they can appeal that. Any denial notice should include instructions on how to appeal or request a hearing, which is the reason why it needs to be in writing. And all OHP members have the right to a fair hearing for denials. Next slide. Some information on who to contact if a member has questions or a provider. General information. We do work closely with the Ombuds team as well, client services team, and the CCO list. Next slide. Paige.
Awesome. So, hi everybody. Since I'm the data analyst, I'm here to talk about monitoring and evaluation and just some of the high-level things we've been thinking about as we move forward monitoring and evaluating the kids in this population. So we've started to outline some goals, what we think we want to achieve, and we're trying to highlight the ones that we think would be most interesting to this group of folks. So we have some big overarching goals and then some strategies, some monitoring strategies to reach those goals. So just to start off, we want to ensure equitable access to medically necessary and medically appropriate services for children. and young adults under 21 enrolled in Medicaid. And really this also includes WISHN, so those folks under 26 who have medical complexity or are eligible for the WISHN program. And as we have other groups that we will likely monitor in the future, like former foster care youth up to age 26 as those policies move forward. We would like our monitoring and evaluation to promote care coordination for EPSDT beneficiaries who have medical complexity or who are former foster care youth or associated with welfare. So we have these groups in addition to some other, what we've sort of been calling EPSDT priority groups, where we really want to make sure we are able to see if they if they have differences in care. Ensure awareness of EPSDT benefits within OHA and to beneficiaries, Medicaid providers, CCOs, and the legislature. So this presentation is sort of part of that. We are on our roadshow hoping to tell more people about EPSDT and ensure EPSDT is responsive to the needs and experiences of beneficiaries and providers by monitoring and evaluating what is useful to them. So I can sit over here and look at my data, but we also, produce something that we think is, we want people to see or the public to see, but we also should really be responsive to what members and their families want to know about themselves. And so really trying to think of how we can get at that. So now I'll share some, overarching objectives. So we'll sort of start by identifying and tracking certain EPSDT outcomes and process measures. So for example, looking at well care visits or topical fluoride or things like that. Some of those things we already track, like in the CCO performance metrics dashboard, but thinking about what outcome and process measures we want, and then we'll start to, stratify those by our EPSDT priority groups and, the other granular demographic data we have from our race, ethnicity, language, and disability data that we collect at OHA. And yeah, so just wanting to make sure that whenever we're looking at an outcome, we're looking at granular groups that could be impacted differently based on that outcome. We want to increase education, outreach and resources, including data resources like reports and dashboards for EPSDT beneficiaries, families, CCOs, and partners, and also providers. So just making sure that we can, coordinate and provide data resources to CCOs and others where, we can sort of collaborate on improving outcomes. And then incorporate beneficiary and family feedback into the EPSDT program operations, and then align data and systems changes as monitoring and evaluation needs. So just trying to be responsive when we learn new things. So with that, I will leave it there and see if we have any questions.
There was one from Kelly regarding access and member understanding of what EPSDT covers. I have a suggestion for the 2026 model handbook. Link the Bright Futures periodicity table in that section. Actually, we just caught that today, so it will be in there. So glad to hear that we were on the right track there.
Great. Any other questions for Jessica and Paige? Great. Thank you, Kelly. All right. Well, thank you, Jessica and Paige, for providing us a presentation and update. We really appreciate your flexibility. All right. And yeah, if anyone has any lingering thoughts later on, or have any questions for Paige and Jessica, please feel free to email them. Looks like they dropped their email in the chat, right? Or is that the link? Yeah, the link. Perfect. All right. And let me get the slides back up. Okay, well, thank you. All right, next up, we're a little bit ahead on the agenda, but we do have our CCO spotlight with Sophia. So Sophia, are you here today? I think I saw you.
I am.
Perfect, thank you.
So, hi everybody. So I am Sophia. I work with the quality team with EOCCO, and I was asked to talk a little bit about what we're doing here at EOCCO, and that is probably one of my favorite things because we are doing a lot of really great things. I also see a lot of my teammates here in the call as well listening, and that is really great because if you have any questions and I'm perhaps don't know the answer about a certain program or incentive I'm going to talk about, I might refer it over to someone on my team. So just be ready for that, guys. So you can go to the next slide. Some learning objectives that I would love everybody to walk away from this meeting with is to just basically be able to summarize EOCCO's current and upcoming quality initiatives and share some upcoming priorities for 2025 and 2026. On the next slide is a little bit of an agenda. It shouldn't take too long, maybe about 10, 15 minutes. If you can go to the next slide, please. I'm going to give a little bit of an intro into EOCCO, some initiative highlights, a couple of trainings that we're working on, including some workforce development trainings and our upcoming priorities and events. And basically, the whole idea is to kind of make this a little bit more of a discussion based, just to kind of learn what other CCOs are doing. Maybe it might inspire you. Maybe you even have like a suggestion or a tip for us. And it's just the whole idea is to spark some conversation. So if you go to the next slide, I do have a little bit of a map of our counties that EOCCO serves. So as you can see here, if you just take the map of Oregon and then split it down the middle, we are on the east half of the state. So EOCCO actually serves the largest geographic area and the smallest in terms of actual population. So we have some unique, some issues that we work on. Our population right now is 76,848 members. So basically, this unique situation means that our region does face distinct health disparities, often found in more rural and frontier communities. And our team keeps this at the forefront of our minds with every single program and initiative that we create. It's all designed to be around the challenges that more rural and frontier areas face. So in Eastern Oregon. If you go to the next slide, I'd love to introduce a couple of programs and initiatives that we're working on. Some are brand new and some have been here for a while. So if you go to the next slide, one really exciting resource that I would love to share is our birth doula resources. So our teammate Hannah Briggs, she works on this one, and it's very exciting because with Eastern Oregon having one of the most highest birth rates in the state, expanding access to birth doulas has become one of our top priorities. So to address this need, we've launched a traditional health worker, so a THW birth doula cohort training with the goal of certifying more doulas in our region. So we're really taking advantage of the birth doula coverage with OHP and EOCCO. So this initiative is specifically designed to tackle the more unique challenges of maternal health in rural areas by specifically engaging members of the community and partnering with, a well-known, more certified birth doula trainer. EOCCO is able to offer virtual birth doula courses and also a 40-hour intensive training. This course these courses are covering topics such as prenatal care, labor, postpartum care, how to get reimbursed through Medicaid as a THW birth doula. And upon completion of this training, participants earn their birth doula certification and receive ongoing support throughout their journey as a birth doula to, get some births under their belt so that they can be a THW. So since this program has launched, the birth doula program, cohort, has successfully trained 25 doulas, effectively doubling our certification rate. Oh, yay, Paige, a former THW birth doula. That's great. I love to see that. So yeah, in Eastern Oregon, 25 is kind of a big number because we do have, of course, the largest geographic area, but the smallest population. So we are continuing to do this to, further support the growing workforce in EOCCO. To support this, we have created a birth doula pathway. So you can kind of see that on the slide here. It allows clinics and providers to refer their pregnant patients with EOCCO coverage to a trained doula for additional support. So it's kind of a self-referral pathway that you can kind of fill out. There's a screenshot here to kind of see what it looks like here. Some measures, incentive measures, always all at the forefront of our mind that are addressed are, of course, our prenatal and postpartum care measure. But, we also like to focus on women's health, mental health, and early childhood health as well. If you go to the next page, you can see another initiative highlight. And my teammate, Michaela, who I think is here, has worked on this very tirelessly for quite some time now. And it's very exciting because it has just recently launched. So we have launched our EOCCO self-referral form. So we have partnered with Orprin from OHSU and Unitas to develop a pathway for patients to self-refer themselves to services. So basically, the whole idea is once a patient fills out this form, screenshotted here, I know it's a little bit hard to see, it's like white on white. The form responses go to a team of CHWs who then reach out to the patient and connects them to services. The THWs are on Orprin's side, and these services are pretty broad, but we mainly focus on social determinants of health, such as food and transportation and housing, but it's not limited to that as well. Like if a patient is seeking something like NEMT, like the non-emergent medical transportation, these CHWs are trained to help that patient and get them access to care of whatever they need. If you go to the next slide. I'd also love to plug our Teladoc diabetes management program. So this is not a new program, I will say. This program has existed since 2022. It was previously known as Livongo, but it has since migrated to Teladoc. They just had a brand change. So basically, this is a program for all eligible EOCCO members that have diabetes. They can enroll in this program and receive benefits such as blood glucose meters, unlimited glucose test strips, and lancets with an easy reordering process. So basically just as much as they want will get sent to them. Personalized health tips, of course, and health coaching for nutrition, lifestyle changes, etc. Some clinical improvements that our members have seen are that the frequent blood glucose checks for enrolled members have a 71% like normal range, so 80 to 180 mg. Also, we have reduced A1C values of over 1% for members who have started with A1C levels of over 7%. So of course, as measures are at the forefront of our mind always, the A1C pore control is what this is kind of impacting here. But we also like to focus on chronic health condition management in general, health education, and care coordination. So you can go to the next slide here. Another initiative that we've been working on at EOCCO is our first tooth trainings, which is not new. It's been kind of a thing throughout not only EOCCOs, but others, pretty much all CCOs. We have We are partnered with Advantage to offer first tooth trainings to our medical professionals. And this could be, MDs, MAs, anybody that basically works with the pediatric population, to get them certified in oral health evaluations, just, understanding the basics of that, and also fluoride application and billing EOCCO for those services, because as you might know, that it does impact our preventative dental preventative dental measures. Specifically dental care, we have seen a huge health disparity in our Eastern Oregon region, especially with, dentists being hours and hours away. We do see less utilization in our, half of the state here. So we really like to focus on kiddos getting that any preventative dental services that they can, including going in for their annual well child visit, just at their regular clinic. If they can get preventative dental services anywhere else, that would be great, but this is just another way to impact them and get them at least some care that they need. So we do have clinicians and clinics coming to get one-on-one trainings with a advantaged hygienist. However, we are starting to offer biannual first tooth lunch and learns. So these are basically very open-ended. Every 6 months or so, we have an hour and a half blocked out for people to come in. They are virtual, and just listen to an advantaged dentist talk about the basics of, fluoride varnish, oral health care, dental health care, different things like that. The dental hygienist is a wealth of knowledge, so it's also an opportunity to kind of have a roundtable discussion. If a clinician has already had their first tooth certification, they can come back and ask any questions that they want if they maybe were wondering about something, and they are able to get a 1-hour CME. So that's another incentive to get clinicians in the door. We have noticed that for our clinics that have staff that have been first tooth trained, they do better on their preventative dental measures. We really encourage, just implementing it right in that workflow when a child comes in for their well child visit, to just add on a fluoride varnish or oral health evaluation. Since 2023 and 2024, we have held 9 trainings. 44 individuals have been trained. 14 different types of staff have been trained. So like I said, it could be MDs, MAs, like anybody who works with the pediatric population that can, off bill Medicaid pretty much. And 21 PCP clinics have trained staff in Eastern Oregon. You can go to the next slide. So one of the most challenging and nuanced CCO incentive measures is our meaningful language access to culturally responsible healthcare services measure. I'm sure we all know, as we're right in the midst of reporting season right now. This measure, of course, tracks the certified and qualified interpreter services provided to members with limited English proficiency. So as a CCO, we're very aware of these challenges that many patients and providers face in accessing interpreters that specifically meet OHA certified requirements. Because of this, our CCO has pledged $1.07 million to fund trainings for certified and qualified healthcare interpreters. So we try to support hybrid healthcare interpreter training courses that run through the Oregon State University by providing a set number of scholarships for students, and supporting a 30% tuition discounts for students residing in Eastern Oregon specifically, to kind of incentivize our Eastern Oregon staff to come out and get certified. We also really try to facilitate students taking those proficiency tests required to enroll in the course, because, a lot of times people, healthcare providers might be bilingual and they don't really feel a need to get certified because they don't, they take care of their patients just fine. So we're trying to get, our patients or our providers in the door and just getting certified, even if they are already bilingual, just making sure that we're hitting this meaningful language access measure. So since this program's inception, EOCCO has supported, I think, 4 cohorts of students, but correct me if I'm wrong, my team members on the call. And throughout this course, 28 individuals have been added to the OHA interpreter registry. And then if you go to the next page, I just have one more highlight I would really like to plug, and then I will wrap it up and open it up for a discussion and questions. But another major initiative that we have launched has been our centralized online print resource order form. So we have a lot of really great materials that our marketing team over here has created for patients to access different things like, diabetes flyers, and basically all of the initiatives that I just talked about, we've got a flyer for. So we have a centralized platform now, and it's that screenshot here in the middle for providers to order. And as soon as we get those orders, we send it right to the clinic so they can kind of advertise, if it's patient facing, to advertise at their clinics. So of course, these materials support many of our incentive measures and programs across EOCCOs. And you can also find lots of flyers with links and QR codes directing you to like different online forms. So these measures address pretty much all of them. We have a flyer for. So if you go to the next slide, I'll just wrap it up with just talking about what is next for quality, like what we're up to right now and what we're going to be up to in the future. So if you go to the next slide here. So right now, and I'm sure all of you are feeling the same way, we are just right in the midst of reporting season. So right now, our team just basically has our head down and we are collecting the data and reporting on the data. And that's basically our main priority right now. However, after we're done with that, since our Eastern Oregon half of the state, it can feel a little bit isolated to be out there. So as a team, we really prioritize traveling out there. Our, offices are based in Portland. However, we have a budget to travel out there for, a couple months at a time. So right after reporting season starting in April, my team is going to hit the road and we're going to go visit all of our clinics in person. During our clinic visits, we like to talk about different things like incentive measure performance, how they're doing, some upcoming initiatives. Just like have been telling you, I'll update them on new things, different events that we're doing, different certification or workforce development events as well. So that'll be April, May. And kind of in the middle of the year here, we do like to have increased focus on upstream measures. So that includes like program management, developing more incentives and different things to impact the measures that might be like more long-term. And then in fall term, right when the year's just about to end up, we like to go back out again. And we like to, check in on our clinics to see how they're doing with their incentive measure performance. Do they need anything from us? Can we help in any way? Do they have questions about reporting, especially with those CQMs or any of those measures that are more complicated, just to make sure that they feel ready for the end of the year. And then rinse and repeat. We just do that every single year. And it seems to be working okay. If you go to this next slide here, I just want to plug a couple of events that we're up to. So like I said, we have our first Tooth Lunch and Learn in April for our IET measures, the initiation and engagement. We have a quarterly kind of lunch and learn collaborative for providers to come in and ask any questions, because I'm sure this is one of the more complicated ones. So it's a really great opportunity for them to come in, learn about the measure a little bit more, and ask any questions surrounding billing or anything like that. And we've also just developed a QI team office hours. So starting on the second Tuesday of every month, we will have an hour, and our team's kind of splitting this up equally to talk about a measure. So our March topic, it already passed, but we talked about our childhood and adolescent immunization status. And then our next month, our April topic will be our well care visits. We'll just have a full hour for clinics to drop in whenever if they feel like they have some questions and ask anything they want. It will be loosely structured, but it's more of an opportunity for them to just, ask any questions that they want. You can see also the order of our topics are really strategic. Our first topics are childhood IMSS and our well care visits. Those are our birthday based, measures. So starting to talk about those at the very beginning of the year was very strategic, just to make sure there are no questions, no confusions. And then as we go on, we'll talk about more and more measures. But yeah, so the next page here is just some links to any if you have any questions, you can send an email to me. I can also put my email in the chat here, but I would like to close out and just open it up to the rest of the group if anybody has any questions. If I can't answer, my team is here and they can help me.
All right. Thank you, Sophia. No,
Yeah.
any questions for Sophia and EOCCO? All right.
Thanks, Harmony. Okay, thanks everybody. Yeah, and if you any questions do come up, just please pop them in the chat. But it was great to kind of like update everybody on what we've been doing. And yeah, I love to learn about what other CCOs are doing as well. So I like this spotlight idea.
Awesome. Well, thank you so much, Sophia. It's all great work that y'all are doing on the east side of Oregon. Thank you so much. All right. And of course, just a reminder, if you'd like to also present for our CCO Spotlight for any of the upcoming months, please feel free to reach out to us. We'll have the email. Actually, I think we have a link as well if you'd like to request your spotlight. We do have a link for that as well. But thank you so much. And really like to hear also any feedback as well. If there's any, I would say CCO, I would say related updates that you'd like to hear, please feel free to add that. Of course, we'll include the links towards the end of this meeting as well. So now we've reached the roundtable part of our agenda. So really, this is just time if you have any questions or feedback or concerns that you'd like to bring up at this time, please do so. We can also just use this time as like to provide any kudos and any celebrations. But does anyone have anything in mind for today? Oh, thank you, Tiffany. Yeah, Tiffany included the links in the chat. I'll wait a little bit to see if anyone has anything. Okay. Well, the engagement and collaboration team does have a question to bring up to you all, really to gather feedback about this topic. We, as you all know or may know, we do have a newsletter that goes out every week. It's called the CCO Weekly Update Newsletter. Usually goes out every Friday, usually midday Friday or so. And this is really just to connect everyone with what's going on as far as like our CCO's contracts and any engagement that we may have as well, any of that type of news. So we wanted to gather feedback as far as the cadence of this newsletter. Currently, it's on a weekly basis, but we wanted to see what everyone thought. Should we change the cadence? Should we keep it as it is? Does anyone have any thoughts or preference? This is just more together, I guess, whether this newsletters has been helpful or not on a weekly cadence. But yeah, does anyone have any thoughts? Okay. Looks like we don't have anything in the chat yet. We'll continue thinking about it to see how we feel about this cadence. We just wanted to bring this up to you all and see if anyone had any thoughts about this. We'll move on then. to the ending of this meeting. Thank you all for joining us this afternoon. Our next meeting will be next month, April 15th, every third Tuesday. Looks like Belle included a chat. So Belle mentioned the weekly is helpful for me as I share out info to others and know when I can expect updates. Wonderful. Thank you. Thank you so much for your feedback. Yeah, if you have any thoughts, please, I encourage you all to use the chat to include any of your thoughts about this topic, or feel free to reach out to the team. For this meeting, we'll still keep the cadence for every third Tuesday of the month. Our next meeting will be April 15th. We do have the links, of course, if you have any agenda requests for any future MEOC meetings. And we'll see if we can add anything else. I also wanted to remind you all to please verify that you have the appropriate team members who have this meeting series. If there's someone who's missing and you think that it would be very valuable information for them, please feel free to forward the invite series over to them or email the CCO engagement collaboration team. We just really want to make sure that everyone has access to this meeting. All right. Well, thank you, everyone. And that's just about it, the ending of our meeting. Really appreciate you all for joining us this afternoon. I hope you all have a great rest of your day. Thank you.
Thank you.
And thank you to our presenters.
Thanks, everybody.